Welcome to this Racial Justice Forum. We will be streaming live via Facebook for the next hour. I'm your moderator for this evening, Kyle Bender, and I would like to introduce our esteemed guests here. First, Jeannine Lee Lake, 2020 candidate for Congress in Indiana's 6th District. Sadie Harper Scott, who's the president of the West Lafayette NAACP. Dr. Woody Myers, 2020 candidate for governor of Indiana. And then last but not least, my good friend Joe Mackey, 2020 candidate for Congress in Indiana's 4th District. Joe's going to be serving a little double duty this evening. He is a participant, but he's also technically our host for the evening. And I'm just going to throw it to him and let him get things started. Go ahead, Joe.
So I want to extend a great thank you to Jeannine Lee Lake and Dr. Woody Myers, both of whom are very busy campaigning these days. And to my friend Sadie Harper Scott, it's always a pleasure to be in your company, Sadie.
Thank you.
I would just like to open by going over a discussion I had last week with my friend Russell Hardy. Russell Hardy is the president of the Putnam County chapter of the NAACP. And we were talking about implicit bias in largely homogeneous communities and some of the challenges that he and his membership face in addressing some of the issues that we're seeing today. And I know I was with Sadie a couple of weeks ago when she was officially hired as the Inclusion and Diversity Director here in Lafayette with the Tippecanoe County School Corporation. And I was wondering, Sadie, if you might address for a moment some of your challenges in the new job you're taking on.
Well, yes, thank you very much, my friend Joe. I'm grateful for this invitation, and certainly I am pleased to be the first diversity coordinator director for the Tippecanoe School Corporation. And I know that we all have challenges in life, but I'm certainly honored because some of the strength and everything that we're trying to accomplish throughout this, we need the help of everybody. We need everybody's assistance. But my goal is to unite and continue to focus on our young folk. Sometimes our young folk are in positions that they're not really wanting to be in, but unfortunately we have those mishaps. So I am going to be meeting with students and families just to help make the road a little less bumpy for them. They will be have someone that they can contact and they will be in touch with. We can help direct some of their challenges that they have, negative challenges or their positive challenges. We can channel them around so that they all can feel better and be able to serve the community. Now, some of our kids of color are different races. We want to make sure we're bridging the gap to make sure that education and equality is for all people and all students and all children. I want to make sure that everybody get an opportunity to reach out and be served in the direction that they should be served. However, with the school now, with things that are happening now, our students are afraid. They're scared. They're fearful. We have to develop more trust, and that's what I am going to be doing. We're going to allow them to have these conversations so that they may be able to be heard. I have a listening ear. I have an open mind, and I'm grateful that this opportunity will strengthen myself as well as strengthen them to be better students, to be helpful students, and be able to be students that can advocate to their peers so that we all can journey together. And I know that sometimes the road gets difficult, but through difficulties, we can change those difficult moments into positive moments. So we want to make sure that we are directing them in that direction and that we will continue to assist them in ordering their steps, whether they be opportunities that they have acquaintance with the police department, teachers, or faith walk members, anybody that they are in contact with, so that we will make the road a little bit easier for them. So I know and I'm aware that I have lots of work to do, but I am prepared because we want to make sure that our students are successful. We are committed, and we want to make sure that we're serving in the direction that we want to be serving. Our parents, we want to make sure our parents become more involved, and a lot of times we have the kids that are wondering minds. We have kids that come from all different backgrounds, all walks of life, but it's our position as role models to get on board. Some of our students come from a village, and it takes a village to raise kids. I am one of those village children. I am a child of 6, so I want to make sure that they understand it doesn't matter when you fall down, you get back up. But together we stand, and we can help improve the lives of our young folks.
Thank you. I must say, Sadie is an absolute treasure, and she is well loved by Democrats, Republicans, Independents, the broader community. And I can tell you that here in Tippecanoe County, we all cheered when Sadie was named to this position. Dr. Myers, I'm wondering if you might talk a little bit about how, as governor, you might help schools create positions such as Sadie's across the state. Is that something that you find feasible?
First of all, Joe, thank you again for the invitation to be with you and your viewers tonight. It's a pleasure. It's an honor, especially on this topic, given the upheavals that we've seen nationwide, if not worldwide, over the last couple of months. It's a very timely topic, and it's an especially timely topic here in Indiana, because unfortunately, Indiana has seen its more than its share, I think, of incidents in our state that we are not at all proud of. They've gone national. People have seen some of the ugliness that still exists in our state. Fortunately, the more recent incident in Monroe County has been investigated, and the prosecutor has taken action, and charges have been filed. And I think that's appropriate given the gravity of that situation there. So race is an issue still in our state. I have grown up in Indiana, and it's been an issue certainly for me since I was a boy growing up in Indianapolis. And to be honest, things are better now than they were then. We have made progress, but not enough. And the progress has been uneven. It hasn't affected everybody equally at all. I grew up in a neighborhood in Indianapolis called Martindale-Brightwood, and that area is in zip code 46218. And if you Google 46218 for lots of different indicators, you'll find that it's one of the most challenged districts in our state, the most challenged zip codes in our state for a variety of educational issues, health issues, and other issues as well. And that's where I spent my childhood. And I saw my share of racial incidents, of racial troubles growing up in Indiana. And now the new generation, the younger generation, is seeing a resurgence, at least publicly, of those difficulties. I think one of the major differences now, Joe, is that so many of these incidents, which weren't believed before, are being recorded on our devices.
Yes.
And that are immediately being sent to Instagram and Facebook and Twitter and other places, so that people can see that they indeed did happen. Whereas before we were lied to and told that they didn't happen, and people were exonerated inappropriately for incidents that today it's much more challenging for them to be exonerated for. So race is an issue. Race is clearly an issue now. It has been an issue for the entire time I've grown up and been alive here in this state. We are making some progress, but certainly not enough. And I'm looking forward to, over the next few minutes, or 30, 40, 50 minutes or so on your Zoom, to talk about, and Facebook. I don't want to make sure we talk about Zoom and Facebook. I don't want to show favoritism to one towards the other, but that we talk about all of the issues in healthcare, in education, and in other areas, Joe, that where this issue has shown its ugly head, and what we need to do to change our trajectory. And as governor, that will be my priority. You know, we know that the governor has a bully pulpit. The governor can stand up and say things that people will listen to. The governor has an opportunity to point the finger or point the spotlight on a variety of issues. The governor also has a chance to put legislation in play that can change policy. The governor has an opportunity as well to direct dollars towards the priorities. So those are the levers that the governor has, and I will certainly use them in order to make more progress and make it faster here in Indiana.
Thank you. Thank you so much. Jeannine Lee Lake, my friend Jeannine, you and I are in a position where we're running for Congress, and I'm going to jump forward to November, and you have been elected. Greg Pence is going home.
Yes.
And I guess my question now is, knowing what Sadie is doing, understanding that we'll have a friend in the governor's office, where do you see our roles in Congress in helping to achieve some of these goals, Sadie's goals, Dr. Meyer's goals? Let's just focus on education for a minute, because we will get to healthcare. But let's just, if you will, can you give me some ideas on where you think our Congress should be working with governors and schools?
Yes, and I have to echo Dr. Myers really quickly and just say thank you so much, Joe, for having this racial justice discussion. It's vital right now. It's kind of a hotbed or a hot moment discussion, but really it's discussions that should have been happening for many years, and we are catching up. So I'm glad to be a part of the catch up. I'm glad to be a part of this movement. They say it right now. It's the largest civil rights movement in the history of the world. It encompasses all 50 states, over 20 countries. We have a sense of urgency at this moment to make things better. And I think it's been coming for a long time. It's been in the atmosphere, but you have pockets of people that are helping and different, agencies, sometimes, Kyle, that are kind of on board. And sometimes it seems like it's the same people kind of again and again that you see in the helping kind of positions. But now, George Floyd, unfortunately, his tragic and public killing where everyone could see it, it was just such a watershed moment for this nation and this world that we had to act. And for the first time, like Dr. Meyer said, people really saw what was in front of them. And I have many friends, that told me that they didn't realize it was so bad. They honestly, frankly, did not realize it was so bad. And so when you start looking at some of the wellness factors, everything from home ownership to education, healthcare opportunities, prison sentencing and things like that, you just see time and time again that African Americans are at the bottom of every one of those wellness indicators. And so we're at the moment now where we have to have the voices coming together, and they have to be diverse voices. I'm so glad that you have Dr. Hopper Scott on talking initially about education, because when I tell you, I mean, yes, there is obviously the discussion that needs to happen about police brutality and other things. But truthfully, when you think about the idea that for every white girl that's in school, 3 girls who are Black and African Americans Black girls are disciplined 3 times as much as white girls. That's what I meant to say.
Right.
The school to prison pipeline is real for African Americans and minorities. I don't know if it's because some of the teachers really don't need more training. I don't know if they need more diverse interactions, but having someone in the schools is vital, because it brings us back. It's going to hopefully reset the tone of every teacher that's in those schools, and maybe before they send that child that's a child of color to the principal's office, they think, would I be doing this to someone else? Is the color of their skin, is it threatening me? Which sometimes it is threatening if they don't have any kind of relationship with African Americans or Latinx communities.
Right.
And it's really, so yes, I would definitely, I'm for that. I think it's vital. Those kind of pieces of, getting people into those classrooms and into those schools, having SROs that are mindful that you know, in terms of how they're sending, you know, these children of color and students of color into you know, juvenile systems, and what their protocol is with regards to being able to maybe do better and de-escalate situations and things like that. So I think, you know, when we get to Congress, Joe, you're going to be there in the 4th district, right? 4th district.
I will be there.
Okay, we're gonna shake hands, and we're gonna make a difference.
And we're going to work.
You know, we are, and because the thing is that you care, and if you can't acknowledge it, then it's not a problem. So just like I said, I'm so grateful that you're having these voices come together and discuss this. Thank you so much, and thanks for having me.
Well, you know the old song, it's been a long time coming.
Change
And it's here now. And
Right.
we're going to have these discussions. I try to hold them. I mentioned largely homogenous communities. The 4th Congressional District is by and large a homogenous community. We have isolated pockets of integration, but it is one of those that, you know, I tell my staff, my campaign, we have to wade into the waters where the sharks swim. If we're going to make a difference, we have to get out there and put ourselves on the line. And sometimes it's not well received at first, but when we engage in discussion, people then become less threatened by the discussion itself. And we're in this position where a great many people, I think, feel threatened by having the discussion. And I think it eases their minds a bit when, you know, we engage in rational conversation. And that's what we're doing, and we're out there. I know you're out there. I do want to move on, and Dr. Myers, I'm going to throw this question at you because for me personally, healthcare is such a big deal. And I am conscious of the disparities in our delivery of healthcare to our minority communities. And I'm wondering if your position as a physician, as a leader of healthcare here in Indiana, you served under 2 governors. I've said it before, I'll say it again, Dr. Myers, I think you're a giant and a hero. And I see us in the throes of a pandemic, and I know there's no better person to address this than you are, sir. Your work with Ryan White literally woke up an entire state of people. And by, at times, what I thought was sheer will, you dragged Hoosiers into a modern and educated means of understanding that disease. Can you talk to me a little bit, talk to all of us about the disparities in healthcare and where you as a governor might direct resources and funding to address those disparities?
You're muted.
Thank you again, Joe. The disparities in healthcare in Indiana are real. They are real nationwide, and they are hurting and killing people disproportionately on the basis of race. We've known about these disparities now for decades and decades, yet we have not made the kind of progress that we need to make as a nation or as a state. Let me just point out a couple here in Indiana specifically. Maternal mortality, Joe, is the measure of the number of women who die at childbirth or within the first year of having a child. Indiana's maternal mortality rate, deaths of mothers, is the 3rd highest in America. It is behind Louisiana and Georgia. We are number 3 in that awful list. And we are just, in my view, ignoring that problem. Far greater problem than many of those that we see on the front page of the newspaper every day, or that we hear on our TV stations or our radio stations in the day and in the evening. In my view, it should be a headline every day that's the status of mothers in Indiana. We're not that much better, Joe, in infant mortality, the deaths of infants in the first year of life. We're number 7 in the United States there. The governor has put in a couple of programs recently that he thinks are going to have effect. I don't have the same hope for them. I just don't think the governor or his predecessor wanted to do what was required, decided to do what was required to really fix these issues. We have about a third of the counties, Joe, in Indiana that are maternity care deserts, i.e. you can't get prenatal care in those counties. So women either don't get it or they have to go to a neighboring county. One of the major contributors to infant and maternal mortality, Joe, is the continued use of tobacco by mothers in our state. Indiana has a smoking rate that's far higher than most other states. We're at about 22%, over 1 in 5 adults in Indiana still smoke cigarettes. In 2020, still smoke cigarettes. And one of the reasons is that cigarettes are less expensive here because our cigarette taxes are lower in Indiana. And so not only are we contributing to the mortality of women and babies here in our state because of that, but we're contributing to the mortality in other states because they come across our border in order to buy Indiana's less expensive cigarettes, and they go take them back to the states that they're in. So you will see a Myers administration focused like a laser on health disparities, on questions of access, on questions of public health, and you will see me appoint a state health commissioner who's going to get up every single day and work her or his heart out to make sure that these disparities are disparities of the past and not of the present or the future. And so that's clearly the goal. And let me just also mention the fact that COVID-19, Joe, has exposed the disparities in even a more stark relief. Testing rates of positivity are twice as high for African Americans. The rate of deaths for African Americans is 3 to 4 times as high as for others because of the diseases that are disproportionate in the African American population. The people with heart disease, people with lung disease, people with diabetes, all die quicker of COVID than do others. And because populations of African Americans have much higher rates of these diseases, they are now dying of COVID-19 at a disproportionately high rate. So these are just a few of the challenges that we have in our state. And it's one of the reasons, Joe, I decided to run. Because when I was health commissioner, I saw these public health issues, as I said, in stark relief. We haven't made the progress we need to make. And instead of becoming that angry old guy that throws things at the television set and wants things to change, I decided that I had to get in there myself and roll up my sleeves and offer my services to the state in hopes that we could make some real progress in that 4-year period of time. So that's clearly very high on my agenda, and it's a problem that can be solved. It's not one of these problems, Joe, that has no solution. It definitely has a solution.
Right.
Other states are much better than we are. And it's not rocket science. Let's copy what's working in other states and bring it to Indiana.
Exactly. I would just say, having our family's experience woke me up to one true fact about Americans and healthcare, and that is this: in the 33 developed nations of the world, everyone has a single payer system. What this does is people do not see healthcare as an expense as much as just a facet of daily life. So they are far more engaged in a healthcare program from the earliest of ages. Whereas we as Americans, because we're viewed as a healthcare market and people are viewed as healthcare consumers, we view it as an expense, and far too often we wait too long to engage with healthcare providers. We're often sicker before we go see a physician. Our illnesses are more advanced, and I see this as a real detriment, and one of those issues that keeps people from engaging in a comprehensive healthcare program the entirety of their life. Now, you mentioned maternal mortality rates and infant mortality rates, and I would throw this question out there at Sadie, because I know you and I have had these discussions. Sadie, where do you see the community? And I don't want to just focus on Black women. I think Hispanic women are in this, Latino, the minority women. How do you see healthcare playing out in the minority communities?
I see it that we can do better. I have worked and have been speaking with other organizational leadership, and hopefully we will bring change about. I think it's a key idea, a key thought, and I think we can do much better than what we're doing. However, with the key people at the table and on the menu, we as a team are going to work to bring that forward with that. And with Joe coming on board, we'll be even much better off. We're grateful for that. So certainly the need is really at high level.
So before I move on to Jeannine, I had a conversation some time ago now with a woman down in, I believe it was Fountain County, Warren County, and they had a Planned Parenthood office there. And she was telling me that women got their health care there. Women were able to see an OBGYN, a gynecologist, to get healthcare checkups. And Indiana then, of course, under the 115th Congress and here in Indiana, they defunded these offices and they closed. And now women in rural communities found themselves, as Dr. Myers pointed out, in a healthcare desert, which if you superimpose the healthcare deserts over the nutrition deserts, what you see is rather terrifying. Jeannine, maybe you and I can talk a little bit about where you think Congress ought to be going in terms of healthcare.
Well, with regards to, I'm just going to talk really quickly about COVID, just because we had touched on that just a second ago, but
Sure.
Dr. Myers mentioned the disproportionate number of African Americans, minorities that are affected, and I believe we have up to 12% Hoosiers that are people of color. Yet, I believe I think the numbers in terms of deaths were about 26%, and you know, those are devastating numbers. I was obviously, you know, I don't know if anybody, you know this, but I actually tested positive for the antibodies myself during, it was after the quarantine was over. And I started getting I started getting testing every week since I was starting to go out a little bit more and doing campaign events. And so I started getting tested every week. And thankfully, you know, I've had 6 or 7 tests that have come back negative. But during this time, my family, we talked a little bit about, like, you know, well, let's just go ahead and take the antibody test and see what happens. I thought it was kind of like, okay, no big deal. But I tested positive, which means I've had the virus. And so one of the things I'm grateful for at the time is that I was in quarantine because, you know, my family, they're getting ready to take the test this next week. If they were affected, we all really were either asymptomatic or had very minor things that we attributed to other things. So one of the concerns, obviously, that I have is that, you know, with the Republicans right now, I'm not sure, Joe, do you know how many times they've actually tried to appeal the ACA and to take?
Oh, I want to say the 115th Congress did 54 attempts to defund the ACA before it finally made it to the Supreme Court. Of course, right. We're back there now. I believe here in August, the Supreme Court will be hearing this. If they should kill the ACA, we're going to lose immediately 20 million people off the healthcare insurance rolls. I believe it's going to be much higher than that. I believe that if this is killed, what you're going to see is healthcare insurance cost climb exorbitantly, and the coverage that you will be buying will get narrower. We're going to lose hospitals. Hospitals will be closing at alarming rates. They're already closing at alarming rates in the rural communities, but now we're going to see them in the metropolitan areas, the urban and suburban areas. So I see what's going on with the ACA as being catastrophic. I will say this, you know, we talk about the Republican Party, and I think there is a disconnect between the Republican Party leadership and your average working class American Republicans. And I say that because we watched what Oklahoma did back here in the primaries, their primaries. The Oklahomans actually voted to join the ACA at a time when their own state party leadership and their national party leadership are trying to kill it. So I think there is a big disconnect. I think the average Republican voter honestly sees the benefits of the ACA. I believe they see that. I get out into the communities, largely the rural areas, where a large number of our farming communities and their residents are on the ACA. And they're very concerned right now. They're very concerned that A, they're going to lose their health care insurance, and B, they could very well lose their local hospital. So I think that, you know, the ACA has been vilified, but I think as people have become accustomed to it, acclimated to this idea, I think they're far more willing to embrace it.
I think so too. Go ahead, Kyle. I'm sorry.
No, finish what you were saying, and then I had a question for Dr. Myers.
Oh, well, the only other thing I was going to add was with regards to women's reproductive rights and the importance of somehow finding ways to bring healthcare to some of these agencies that, you know, Planned Parenthood has taken away, sometimes the only source of birth control, women's health care that many of these minority communities have had. I know that when I was a freshman at Ball State, it's been almost 30 years ago, but when I was a freshman at Ball State, there were the powers that be that closed down the Planned Parenthood in my town. I've seen it over and over again. We recently had a young lady who actually has adopted two kids, two kids that were in the foster care system. And then she actually was telling me, I mean, she's this wonderful person, but yet she has to travel maybe 50 or 60 miles to the next area to be able to get affordable health care. So, right. You know, we're penalizing people that work. We're penalizing people that are trying to get ahead, and you know, just by pure politics that are driven by, unfortunately, some antiquated religious views.
Thank you.
And I would say I would open this up to everyone, but if the ACA were to be repealed, I mean, how would that affect people of color? I mean, it's going to hurt everyone, but everything always disproportionately tends to hurt people of color. And I just wonder how that might look and what that might look like, as scary as it is.
Well, the access issue, Kyle, is going to get a lot worse very quickly if the ACA were to be repealed. But frankly, I don't think that Republicans truly want to repeal it. I think that they've tried it. You think about it, they've had majorities in the House and the Senate, and they've tried 70 times and they can't get it done. I don't believe it. I think that they want to give you the appearance that they have tried to appeal to get rid of it, where in fact a lot of the insurance companies have figured out ways to do well managing the benefits for states and others with the ACA. So I don't think there's I worry about it, but it's not at the top of my worry list that's going to happen soon because of the very high popularity of the benefit of keeping your kids on until age 26, and pre-existing conditions. That's an issue that affects everyone, not just African Americans or Hispanics. So I moved it down on my worry list some over the last few years as I've seen this this evolve. But nonetheless, we still have huge problems in healthcare in the United States today, and COVID has just made them much worse. And I know that we would need, as governor, I will need the help of the congressional delegation in Washington every day to make sure that the federal programs are well funded and that Indiana is getting its share of the dollars that are being made available for those programs, because Hoosiers are going to be very dependent upon the federal match for Medicaid as well as a robust Medicare program, as well as the grants that are given to the state through the health department and other agencies to get public health infrastructure improved. We just are very highly dependent on that federal assistance, and we're going to need more of it, not less.
Thank you.
Thank you. I want to say I was reading an article just the other day, and while it didn't necessarily, I don't want to say it didn't shock me, but I find it to be, just extremely disturbing. And the article was covering the statistics on Black children post-surgery and their mortality rates. So Black children are dying in higher numbers following a surgery. And a great deal of that, I think, is accessibility to your surgeon, your specialist, your physicians. I'm wondering, because I am focused on our children. Let me just say, I am focused on America's children. But I find this to be very disturbing because that number was so much higher than any of the other races. And I see that as part of the lack of quality health care that we're delivering to the communities. And I know we've kind of covered that a little bit, but for me, it was chilling to see those numbers. And I'm wondering if when we talk about our children, the minority children, can you give me some ideas on where you think we can do better?
Oh, everywhere.
Everywhere.
That's an easy answer. Unfortunately, it's an easy answer. It's everywhere. And COVID again has made it worse. On the issue that Jeannine brought up earlier, I just looked up the most recent numbers. According to the state Department of Health today, about 9.9 or so % of Hoosiers are African American, but it's 14.1% of the deaths from COVID. But I think that undercounts it because so many of the deaths are not classified. So it's probably higher than that. Jeannine's numbers are probably closer to being accurate. But pick an issue, Joe. Pick a disease, and it is highly likely that there's going to be a disparity, whether it's adults or infants or children, women, whether it's the elderly. Unfortunately, there is likely to be in this country today a disparity. And that's not to say that we don't have dedicated nurses and doctors out there doing their best, but the system does not work for everyone. That's the problem. And it's going to take the cooperation of the local, state, and federal governments and the private sector to change things to make them work. And it's going to take the pharmaceutical companies and looking out for the prices of the drugs that they're offering to the population. It's going to take the pharmacies and the pharmacists working together. It's going to take all sectors of the healthcare economy, which is about 1/6 of the total economy in America today, working to make things better. And that's why I decided that I needed to run for this job. That's why I'm glad you and Jeannine are running for the jobs in your districts, because it's going to take all of us concentrating our energy and our efforts to get these problems behind us. I know that you do not want your children and grandchildren to have to deal with the same doggone problems that our generation either created or should have solved. And so I just am looking forward to your presence in Congress to bring us this new legislation, to bring us these federal dollars, and we'll try to do our best to spend them at the state level in a way that would make you proud. I just see us working together to fix these issues instead of continuously discussing them. We've got to discuss them, but we more than that, we need to fix the problems.
Correct. We do. So I'm going to move on now because there are so many areas where we could talk about these issues all night. One of them that I see is minorities in professional roles, in the roles of police officers, in the roles of teachers, in the roles of doctors and lawyers. Can you talk to me a little bit? I'm just going to throw this out to all of my guests. Give me some ideas on what we should be doing or could be doing to build that population.
I'm happy to start, and I would invite my fellow panelists to chime in. You know, the African American population in the United States is in the neighborhood of 12 to 13%, yet the percentage of physicians is only 5%. And it's been very clearly shown that the race of the physician with respect to the race of the patient, the outcomes are much better when the physician and the patient have better communication, when the patients are comfortable, they ask better questions, the patients follow instructions better, they understand the instructions better, there's a much better ease of communication. So we've got to get more African-American nurses, doctors, pharmacists, podiatrists in the system. And that applies not just in the healthcare professions, Joe, as you are well aware. We need more African-American law enforcement officers, lawyers, judges, et cetera. And that means that we've got to have better K through 12 education.
Right.
We've got to have more of us going to college and graduating with degrees that we can then use to either start our careers or go to graduate school. And then we've got to have more schools like, I'm going to pick on Purdue, since one of our guests happens to now be in the Lafayette, West Lafayette area. And although Purdue does have some programs that I am told are actually very good in working, I don't think that's true across the board at Purdue. And certainly if I'm governor, the state universities are going to get extra attention to make sure that they are offering opportunities across the board and in all of their various schools, undergraduate and graduate, that apply to African American, Latinx, and other Hoosiers, not equally or without bias. And so we've got to work all up and down the pipeline. We don't have the luxury of just deciding we're only going to work on K through 12. It's got to be across the board because we need help throughout the state in all areas.
So Jeannine touched briefly, momentarily, on the school to prison pipeline and how disproportionately our minority children are suffering this. And Sadie, can you tell me?
Here, yeah.
Thank you. When we talk about diversity and inclusion, I'm going to assume, and you can correct me if I'm wrong, the idea is to close down that school to prison pipeline. Is that part of the goal of your job as the diversity and inclusion director?
As diversity and inclusion director, that will be part of my input. Yes, it will, because definitely we certainly would rather see our kids in school being successful rather than to the prison pipeline. That is a direction that we are having, a conversation we're having across Lafayette, West Lafayette, because we want to make sure that the focus of our children and the parents can drive that focus so that our kids can be successful. That is the goal, and we look toward that because as we look to our mourning loss of Congressman John Lewis, education is the front line of engaging our children and our students. And certainly I will have a huge play in that and helping to make sure that schools instead of prison to pipeline. So that's exactly what part of my role is going to be, and to make sure that we continue to talk about diversity, talk about racism, and make sure our students can have that direction that all kids of all races and all colors, and mainly our African American children, will get the same opportunities and same benefits that other kids get.
So,
Sadie, what would be one step that you would take that you think would go a long way towards making that a reality or improving those things?
Trust and bridge building.
Okay. How would we do that? What would that look like?
That will look like people from all walks. We have the teachers, we have the council, we have the principals. I think for me, and have students that actually participate in some of these efforts in trying to help and assist with making them successful. We have to let them know that their voice does count and it does matter. So we need to make sure we're bringing them in and we're tuning them in, and know that it's okay to speak out when things are not okay. And it's not okay to just make sure that you settle for anything. Every child deserves a fair opportunity, a better education, and the opportunity to be able to go to college. That's important for myself and for students.
One thing that I'm always concerned about also, and I don't have the numbers right in front of me, but I've heard, from various parents, is the graduation rates also of especially young Black males. I wish I did have the exact numbers in front of me, but I know just because I've written about it as a reporter, I've been concerned about it as a mother of 3 African American young boys. If they're in trouble more, the odds of them being able to graduate are lessened every time, like you just said. It's something that we have to be cognizant of. We have to make sure that we are hiring a diverse group of educators. We have to make sure that the people that are in those positions right now, even if it's going to take a little bit to bring in another Miss Scott Harper into the mix. Maybe there's some places that can't do it with their budget until next year. But I think just the idea that there's an awareness now that we need those positions to be filled in our schools, and even in like at Ball State, one of the I guess activities that I was involved in back in January, there was a young man, and now it's national news. He was in his classroom at Ball State, and his name's Sultan. He's a friend of my daughter's, and he was had been in the classroom for 30, 40 minutes, and he was asked to change seats, and it was just a very weird kind of situation. And I know, Kyle, it's unbelievable. If you've heard the story,
I'm an educator, so it's frustrating.
Right, I'm sure. And that's actually what happened. So when he did not feel as if that was a fair request, the police was called on him. And it was only by the grace of God, Joe, that the police officer that was called that day was, he actually looked at the professor and he said, this is not right. You don't call the police because someone hasn't broken the law, or there's no appearance of them breaking a law. Not wanting to move seats after you've been in that seat for 30 or 40 minutes already, that's not a law. So, those kind of, that kind of attitude I believe we're shifting now, but we have to make sure that the good feelings are then met and followed up with more positions, like you're seeing there in Tippecanoe County. I think we just did the same in Muncie, which I'm really proud of. So
I will tell you.
And as an educator, Kyle, I'm sure that is very, very pressing on you.
Well, when I just think about when I went to school, I could look around and see a lot of people who looked like me that I could look up to and feel like, oh, okay, I can go to college, I can do all these things. And African Americans sometimes in rural communities, and I'm being a little stereotypical, don't see it as much. And that's unfortunate. I wish we had more African American, more opportunities, I guess, is what would be awesome.
Mm-hmm.
So,
and I can tell you, if I may offer, I was very excited, and I was very happy with the superintendent and the assistant superintendent with Tippecanoe School Corporation, Scott Hamback and Dr. Boo. They sought me. So, however, I am very vocal, but my heart is with children's because I was born as a child. So I wanted to make sure that my direction and accepting my role, that I be able to focus and identify to what diversity look like. And as any kid of color, they need to understand that they have people that they can go to. So it was very, very heartwarming for both superintendents to drive to Indianapolis to seek me, and that was really warming. So certainly our goal is, and I've already shared with them, how do we go about getting more people of color? And that's one thing that they was really passionate about, that there was a need, and they were reaching out. So I shared that with some of the parents because I want them to know, if you find people in ways that you can help, there are acknowledgments that they need folk of color. So to help raise our numbers for our African American children and help them seek the direction for college. That is important. We all need to be listening and understanding how we can get our students and our kids of all colors, and mainly African American, more engaged so that they can feel a part of the system. So that's important for me.
Let me ask, I want to move on because I happened to be at an event here in Lafayette 2 years ago, and there was this wonderful young woman, a Purdue graduate. She was earning her master's degree in mathematics. She was a DACA student, and she wanted to teach. She wanted to teach math. She wanted to teach in the K through 12 program somewhere. And of course, you know, the tribulations and trials of an unfriendly federal government had prevented her from that opportunity. Now, she did not even know that she was an undocumented individual until she actually enrolled at Purdue University. And I want to talk about, you know, when we talk about racial justice and our children, certainly we cannot overlook or skip what is going on, not just with our DACA students, but at the border. I believe, and I'm speaking strictly for myself here, it is the most grossly inhumane action a free country could ever undertake, is the incarceration and criminalization of our immigrant population. I'm wondering if you might expound on that. I know, Dr. Myers, you're running for governor here in Indiana. How do you view our minority population, or undocumented minority population? How can we, in the face of an unfriendly government, work to not only protect these children, but keep them in the system, keep them vibrant and engaged?
Joe, the answer is very simple. How do I view DACA students? I view them as an asset. I view them as individuals who will make significant contributions if given the opportunity to do so. Clearly, determining how we change our policies at the border is a federal responsibility, and I will push the congressional delegation from the great state of Indiana to help us to make those decisions more efficiently and to get that legislation passed. But trust me, as governor, I'm going to do all I can to make those students that are here feel welcome, to make them feel at home, to help them understand that they do have an opportunity to learn here. I want them to take full advantage of it, and if appropriate, I want them to stay and help our state, and to make sure that our state moves forward. We can use the help. We've got lots of problems that have not been solved by the folks that are here today. We've got to give some folks an opportunity to roll up their sleeves and get in there and work with us to get the problem solved better.
Jeannine, I know you and we arrived in Washington, and without question, our undocumented population is going to be discussed. Where do you see yourself, what role do you see Congress as playing in resolving these issues?
Well, I'm definitely a supporter of DACA, and I'm so glad the Supreme Court recently, you know, supported the idea that they can stay. And, you know, they've thwarted the newest attempts by, like you said, our government, you know, to discriminate and to limit access. We have been for many years, you know, the country that has welcomed the least, the last, and the lost. We, you know, we prided ourselves for many years on being the, what do they call it? The
melting pot. Yes,
the melting pot of America.
Right.
You know, and so the idea that we are now under a situation, I guess, where that has been threatened, is very disturbing. Not only, I think there's almost 700,000 DACA recipients, but they bring in money, you know,
Right.
to our communities. They're valuable to
$1 million
our
a year.
Right. I mean,
Right.
it's just amazing, you know, when you have different you know, voices out there, you have different faces out there, different talents out there. We're a better nation when we welcome our borders that are safe and open. And we all want safe borders. I mean, we know that. But, you know, to use it not as a political issue and more as a humanity issue is where that starts.
Right. I was engaged in a discussion with Dana Black on Turn Left here a month or two ago, and we were talking about the immigrants coming across the southern border. And one of the things that I had mentioned was, I tried to talk about was our federal government's role in Central America. And I was pointing out that our engagement down there has been less than virtuous. And, you know, this has led to mothers picking up their children with little more than the clothes on their back and walking 2,000 miles to come here. And people don't just wake up one morning and decide they're going to walk 2,000 miles with their children for no reason at all. And we have failed to examine what's going on in Central America in these 6 nations from which a predominant number of these immigrants are originating. And our policy has been, well, just send them back. And then it was, well, just incarcerate them.
Right.
And I'm wondering if, you know, this also plays into racial justice. So I am fascinated by the role we have played in Central America and the damage that we have perpetrated. And while I don't know that it was necessarily racial based, we can certainly look at the foreign policies in terms of immigration coming out of the executive branch, and we know they're racial based. And I'm wondering if, for the first time in decades, maybe we actually have somebody who's honest about their racism when it comes to the nations of the world who are not white.
I understand your point, Joe, and I know we're getting close to the end here with our time, but you've raised some very significant global issues as opposed to simply state issues that we all have to be cognizant of. And I really look forward to your leadership in the Congress, as well as that of Jeannine's, to help move both of these issues forward. I just, you know, my goal would be, of course, to if I could quickly move to your district and vote, and then quickly move to Jeannine's district and vote for her too, if that were possible. And I don't think it is, but if that were possible, I would do it, because I want to see both of you win, and both of you take those seats away from those that have them today, so that this issue that you just raised and many others will be adequately and appropriately addressed.
We are getting close, and I don't watch a clock when I'm engrossed, and I have been thoroughly engrossed in our conversations. And I would love to do this over dinner sometime with everyone here. So I'm going to do a quick rundown. Dr. Myers, give people the information they need to participate in your campaign. If they want to volunteer, how can they reach out to you?
Oh, that's a great segue, Joe. Thank you. We are easy to reach. You can see I've got a little bit of a screen behind me that has our website on it, www.drwoodymyers.com. In addition to that beautiful corn that you see growing in the background, you've got that information available to you as well. We would love to have folks sign up at the website. You can volunteer there. You can contribute there. You can learn about our positions there. It's a great place to figure out all the various issues that we are talking about, the releases that we've had on these issues. So thank you again for this terrific opportunity. I've enjoyed the opportunity to work with my fellow panelists this evening. I have not yet had the pleasure of meeting Ms. Harper Scott. I look forward to that, hopefully down the road. And Kyle, you've been a great moderator as well, sir. Thank you for getting us started and getting the questions off and running.
Always.
And again, to my colleagues who are going to take over these 2 seats in the U.S. Congress.
Absolutely.
Thank you
Thank you, Dr. Myers. Jeannine, I'm sorry, please tell us how people can reach out to your campaign if they want to get involved. Let the viewers know, please.
Well, you can, it's a long name and I've had it my whole life, or at least the majority for the last 30 years. Jeannine Lee Lake for Congress.com. I answer my own phone, which is 765-212-7537. As long as I can possibly do that, I'm going to keep on doing it. I like to be in touch with people. I have about I think there are about 25,000 followers in terms of our social media platforms, but I've run before. So this, this is kind of cultivating that. And we do run I'm proud to say that we run a very effective grassroots campaign. We're trying to go to the next level through the next 3 or 4 months, August, September, and October, in terms of, maybe getting a little bit more political clout outside of Indiana. And so we've got, some irons in the fire with regards to that. We've had some good vibes as far as what's ahead for us. I am determined to make this district back blue. And it's not just because I want to be, go to Washington and I have nothing else to do. I've had a pretty good life. God's blessed me, to be a happy person and just be, I'm fine. But when you see a need for change, nature loves a vacuum. And I tell you what, there was a vacuum in this district. We have to have someone that will stand, and like you, Joe, I've not met you yet, but I've heard so many wonderful things about you. I've seen how you stood through our adversity with some of the health issues that your family has faced, and just I hear so many wonderful things about you. But that's the kind of person that we need in Congress. We need someone that's going to fight for healthcare for everybody. We need somebody that does want tuition-free college for those that need it. That we want someone that, does care about the DACA kids, and the fact that, we don't want to send them back because of the color of their skin or where they came from. We have compassion that they're from Venezuela and some of these countries that, like you said, that the mother will literally get her on her feet and start walking toward on a 2,000-mile trip. We need people that are like that. So I am thrilled to be in the company of you running this 2020 season and this class that I believe is going to just be wonderful in 2021. Dr. Myers, it's always good to see you. I just was speaking to your wife, Stacy, the other day and telling her how proud I am to just be on the same ticket as you this year in my district, and just to see you running. I know that, things happen the way that they're supposed to happen. We have a wonderful candidate that could literally take us to where we need to be in terms of this state. We are in a pandemic, and the voices that are there right now, this administration has all but conceded that everything from we need to be open as much as possible to not doing a mask mandate, which we need here. Our numbers are rising every day. I think there were 970 some the other day. So we're going the wrong way. We need a leader like Dr. Myers, and I'm just so thrilled that you're running. And thank you all again for having me. I appreciate it.
Thank you so much, Jeannine. Sadie, my friend, I have to say, it's always a pleasure to be in Sadie's company. Never a dull moment. And I look forward to that opportunity. Sadie, you've spent an hour with 3 candidates running for public office. And I'm just curious, if you were to give us any advice tonight, what might it be?
My advice, I just want to thank you all for just making a little space for me to be on with this great panelist tonight. And what I've heard tonight, I have not met Dr. Woody, I have not met Jeannine, but I have met Joe. And I'm telling you, I am so grateful at this teamwork that you all are doing and the journey that you have before you. And what you've said on this call tonight will certainly make sure that that check goes beside your name. So certainly we know that you all will do an amazing job. And Joe is just so amazing. He's amazing. He's amazing. And the work that you all will do will make all of our Hoosiers such better Hoosiers. And we are excited, and the journey to move forward is just so amazing. So I thank you all. And as I speak about DACA, I'm a DACA supporter. If you know that someone is in this area, Lafayette, West Lafayette, or wherever, should we know about it, please feel free to reach out, because so many people miss it by us not communicating. If you know somebody, I had a student that was ready to go off to college when she completed her under program. So what happened with that is I was able to contact an attorney to get her paperwork ready, so if she went out, she wouldn't have any problems in being successful. So if you know that, please let us know. But I'm just so grateful for this evening, for what you all have said and what we are going to do, and know that we're looking forward to this 2020 win. Stay in the game. Don't get out. Stay in the fight. Thank you all, and have a blessed evening.
Thank you all. Thank you all very much for joining me tonight. I'm grateful for your friendship and your presence with us. I hope it was enlightening for those who will view this tonight and those who will view it again tomorrow. And I do hope to see you all on the campaign trail at some point, and I wish you all the very best. Thank you.
You too. And I hope we get the chance to do this again, Joe. I really do. I appreciate you coming from, that voice, which is like, I don't have the answers. I stand with you, but I may not understand. And let's get that perspective out. So that takes a strong person, and I appreciate that again. And you too, Kyle. Thank you for moderating.
Absolutely. It's been an honor just to be with you all and just to learn and be a part of things. And I do hope we can do it again sometime, guys. So that concludes our live broadcast for the evening, and have a nice evening.
We got to get a selfie. I'm the selfie. I'm the social media girl over here. And my campaign manager would kill me if I don't.
And please make sure you're encouraging people to register and vote. Please do that.
Yes. All right. Good night, everybody.
Good night.
Good night.
Good night.